The Diabetes Podcast is for educational purposes only and is not intended to diagnose or treat any disease. Please do not apply any of this information without first speaking to your doctor.
And welcome back, everyone, to another episode of the Diabetes Podcast. Today, we are talking about the thyroid and diabetes. And thyroid is a quick hot button for a lot of people. So maybe this will get spicy, maybe it won't. Let's find out. Dr. Grady, what do you think about the thyroid?
Overall thoughts, obviously thyroid, any organ in the body is important because otherwise we wouldn't have it. But thyroid, especially in relations to diabetes, because it's a diabetes podcast, there seems to be a decently close relationship between the two. And so we're going to dive into that more in this episode. And I'm sure a lot of type 1 diabetics have heard of the thyroid, because if you've gone to an endocrinologist, they have probably checked, quote unquote, checked your thyroid to see how well it's working because of that relationship. And so the thyroid essentially, in a general sense, kind of helps set the metabolism within your body. So it affects all your cells in your body and how well they efficiently produce the things that they produce and or perform the functions that they perform. So obviously it has a global impact on the body, but then at the same time, overall, all the different organ systems can have an impact on that thyroid. So it's a good reflection of, one, how your thyroid's doing, but then also maybe also how the rest of your body is doing if your thyroid's not functioning or is functioning.
Right. I think a couple of things on what you're, not to go on tangents, but just to what you already said. I think when the general Bio 101 summary of the thyroid is, they use the analogy of that thermostat, right? Having increase of thyroid hormones might increase the metabolism, and then that kind of raises the temperature in your body, and then like decreasing the thermostat and lowering the amount of thyroid hormones in your body, that kind of lowers the thermostat of your body, and that would make things cold in your house, right? You don't want to move, you become kind of sluggish. So they use that, analogy of the thermostat of your metabolism as your thyroid. But being type 1 diabetic, what you and I are, and just having diabetes, you might get checked pretty often. And going on a little bit of a story here, when I do my own blood work, even still today, I get my own blood drawn because it's just more efficient, because I want to check a bunch of things at the same time, right? And I guess almost even before going into that, you say, quote unquote, check your thyroid. Maybe it would help people right off the back. What does that even mean before I go into my own story? What does checking your thyroid actually mean versus what, the traditional medical model has been doing for decades now?
Yeah. So the reason why I sarcastically say checking your thyroid, most endocrinologists in the standard medical system will do a very kind of surface level assessment, meaning that they'll just run TSH and maybe T4 for blood markers. Maybe. Most of the time it's just TSH, and TSH really doesn't tell you what the thyroid is even doing, because TSH is actually produced by the pituitary gland to stimulate the thyroid to then produce hormones.
So it's a brain hormone. It's not even technically not even a thyroid hormone, right?
Exactly.
So I mean, there could be other things going on. There could be pituitary. Why am I blanking on it? We need to add that pituitary cancer. Now, I don't want to say cancer, growth
function.
No, I'm thinking about tumor. Yeah. There could be a pituitary tumor going on. I mean, or just pituitary function is just lower for whatever reason. I mean, that's literally a different organ in your brain that impacts the thyroid. Very, very important. You need the TSH, but it doesn't actually tell you how the thyroid itself is functioning, right?
Exactly. Yep. So ideally, you could get a lot better breakdown of how not only the thyroid is working or how it's being stimulated, or how the brain is stimulating the pituitary gland to stimulate the thyroid, But you can also get a breakdown of the different versions of thyroid hormone to see, one, is it being converted from T4 to T3? Is the thyroid hormone being bound up and therefore not able to get into the tissues? So T3 and T4 versus free T3 and free T4. You have T3 uptake, which shows that relationship between the binding globulins, so the proteins that bind them up so they can transport them. All those different things can show you or give you better insight into where the dysfunction within that thyroid loop of that system is at, and maybe what's the more likely culprit of why you are having maybe some thyroid symptoms, even though your TSH is normal.
Right. So to summarize, if we were to do a list, that'd be TSH, T4, T3, and because T3 is the active form, but then those aren't even the true active forms. Free T4 and free T3 are really the active forms of those guys. And then you got your T3 uptake, and you could also do like an FTI, or was that free thyroid index?
Thyroxine index, yeah.
Yeah. And those really give, kind of a relation about your thyroid binding globulins and just how your thyroid is using those hormones actually. Without direct, you could run a thyroid binding globulin, but that ends up being a little bit more expensive. You don't need it necessarily. And then you could do your antibodies, right? You do your thyroid globulin antibody and your TPO antibody. And, so that really is 9, unless I put up a thumb and, when I wasn't supposed to. But, it's definitely more than just 2 blood labs to really understand. And even if you got all that, you should really get that compared with blood sugar, an A1C, and a lipid panel, because that way you can really understand what's happening to the thyroid and what's happening to the body, and you can put those in context with one another, right?
Exactly. Because if you just run a thyroid, full profile like that, okay, we've identified that there's an issue somewhere in that thyroid complex, but that's all we know. We just know there's an issue. We don't really have an idea necessarily of what other systems may be impacting it. Because like I said, your thyroid is a reflection of how well your overall body is functioning, because there's so many different things that can impact the thyroid. And like toxicity, so liver, any sort of elimination system, GI tract, the kidneys, all those things, if those aren't working well, that can impact the thyroid. You've got your blood sugar, which we're going to dive into more, that can impact thyroid. Stress hormones can impact the thyroid. There's so many different things, even just fatty acids, essential fatty acids, and fat metabolism. The thyroid affects those things, but then at the same time, the thyroid function is affected by those. So yeah, just getting that thyroid profile by itself, yeah, if you get the full thing, you get a little bit more information. You can kind of make some assumptions based off of maybe your symptoms or history. But at the same time, it's still a very limited picture. So getting that full picture can give you a better idea on all the different dysfunctions and problems that may be leading to those symptoms that you're having.
Yeah. So quick story. So that I was trying to tell a little bit earlier, right? So I get my own blood labs, and this was back when I was in chiropractic school, and I've been a couple of years out of chiropractic school and practicing now, like 2.5 years, but which seems crazy that that's the time frame already, but time flies. But back when I was in school, I was still getting my own blood labs because I was learning about all this stuff and I wanted to get these labs. And so I would bring my own labs to my endocrinologist, being a type 1 diabetic, and I would have my A1C on it, and I would have, fasting glucose, but also have my thyroid labs on it. And I had TPO antibodies, or thyroid peroxidase antibodies, on it. And it was very little. It was not that elevated. It wasn't like hundreds or thousands. It was like, I don't know, maybe 40 or 50 or something like that. And my endocrinologist looks at the blood work. He's looking at it in front of me, and he's like, got TPO antibodies. Your thyroid looks good right now, but you're going to need some thyroid replacement hormone at some point, just so you know. And my jaw dropped. And I was like, excuse me, you. And I literally told, and we're going to, hopefully that was bleeped out. But his jaw dropped and my jaw was dropped. I was like, wow, I actually just told him to F off. But I was so shocked. And then we had a conversation after that. And then it got very hostile after that, obviously. But I was so baffled that somebody who's supposed to be on my healthcare team, opposed to trying to say, oh, we have these antibodies, relate that to my diabetes, my autoimmunity, say, okay, well, we're going to need to make sure your autoimmunity is dialed in. And, we need to make sure that this doesn't become something worse. But it's good that instead of like saying something like, it's good that we know this now and we could take precautionary methods and steps from there forward. Even if he was in his mind fully going to, that precautionary method meant giving me thyroid medication at some point, or like talking about it earlier on. If you framed it in that sense of saying, hey, we can do something about this now that we know about it, that's way more of an empowering conversation than just saying you're going to need thyroid replacement hormone and just leave it at that. Yeah. And how that encounter ended was I ended up, we were very awkwardly looking at each other. And I was, I'm a young kid at that point, and he's probably in practice for 20 years. And so there was literally no respect on my end, which is not good towards him at that moment. But I was like, how often do you need to see me to write my insulin prescription? He said 6 months. I said, I'll see you in 6 months. and so I only saw him just to quickly talk and for him to write me my prescription. And then I did everything else after that.
Yeah. That's very frustrating, because it's like where is that coming from? Obviously, the traditional medical field just sees that number and equates it. Okay, their thyroid's going to eventually shut down. That's because you're not really doing anything to address why those antibodies are there or what those antibodies mean.
Right.
And trying to help take stress off that immune system so it's not out of control, trying to destroy your thyroid. It's just like, oh, let's just wait until it destroys it and then we'll do something about it.
Right. I mean, I think there is a link between type 1 diabetes and Hashimoto's, which is an autoimmune hypothyroid condition, right? And so there is a well documented, for a while now, that those are linked. There was, in preparation for this recording, I found a meta-analysis from 2014 that marked increase in thyroid dysfunction with people with type 1 diabetes. When they looked at over 2,000, almost 3,000 young people and, almost 800 adults with type 1 diabetes between all these studies. And so there's a very clear genetic link between type 1 diabetes and Hashimoto's. So it's something that's common. But man, what kind of disempowering conversations are you having with a practitioner versus empowering ones? And you should always err on the sides of empowering.
Mm-hmm. Yeah. Find somebody that's going to at least try and help you get there if that's what you want to do. Because obviously there is a lot of people out there that don't want to make the changes to make sure that you don't have a problem with your thyroid and or other autoimmunities, because I think that relationship is so well studied, because one, it's been observed, but at the same time, those are probably the thyroid specifically is probably the most tested autoimmunity. And so I feel like that's an easy relationship to see. But if you have one autoimmune condition, you're likely, or the likelihood that you're going to have another one, if you don't change your lifestyle and you just kind of live the same, I hate to say it, but kind of crappy lifestyle, then you're likely going to have another one develop, whether that's to the thyroid, to your gut, to your brain, whatever the case may be, you're likely going to develop that because your immune system is identifying your body as foreign. And there's a reason for that. There are reasons for that.
We maybe can circle back. That might be a good tie-in at the very end of like about autoimmunity and maybe how that process actually happens, right? With different antibodies and maybe talk about leaky gut and all that fun stuff. Maybe we can kind of hit on that at the end. I think that would be a good circle back. But yeah, without a doubt, it's all linked. If you continue to do that, lifestyle that is leading you one place, it's probably going to lead you another place without a
Yeah,
doubt.
further down that pathway. Yeah.
So how is why don't you kind of talk about Doc, some influences that being a diabetic has, or just blood sugar has on the thyroid, to kind of go from a more mechanism perspective right now?
Yeah. Yeah. So from whether we're talking about type 1 or type 2, blood sugar in general is gonna impact your thyroid pretty severely. It's probably the most common and most impactful dysfunction that leads to then thyroid dysfunction. So with blood sugar, we've talked about this a lot on this podcast, but if you haven't heard it, blood sugar affects your cortisol very intimately. And so when you have low blood sugar, your cortisol spikes, which is your stress hormone, to help bring your blood sugar back up. And then at the same time, when your blood sugar is high, it also increases cortisol and further promotes that issue. But cortisol is one of the biggest disruptors of the whole feedback loop that the thyroid has. So we kind of briefly mentioned it. So I'll briefly kind of go through it again. So you have the hypothalamus, which is part of the brain, which stimulates the pituitary gland, which then stimulates the thyroid, which then produces hormones, which then goes out to the tissues. Primarily gets converted from T4 to T3 in the liver, but it does get converted in other tissues. And then that acts on the end tissues, which part of that is then the hypothalamus, which then senses in a certain way how much you have and if you need more or less. So that's that whole feedback mechanism and that whole loop there. And cortisol disrupts several of those different areas. So one of the biggest ones is the hypothalamus. That's that part of the brain, and the pituitary. Both of those can be greatly impacted by high cortisol and be disrupted. And so when you have less stimulation from the brain and pituitary gland, obviously you're not going to be getting or producing as much thyroid hormone in general. And then at the same time, your conversion of T4 into T3. So T4 is what's primarily produced by the thyroid gland, but then T3 is converted by your liver and some other tissues. And T3 is the active form. So that's the one that's actually going into the cell and acting on the nucleus to increase metabolism and whatever that cell does. So that conversion can be impacted by cortisol. And so the blood sugar and cortisol are very intimately tied. And so when you have a lot of blood sugar dysregulation, whether it's low, whether it's high, or whether it's swinging up and down, that can cause a lot of stress on the body in general, but specifically talking about the thyroid, it's very greatly impacted by the thyroid. So it makes a lot of sense why there's a lot more stress on that thyroid and why that thyroid would then be causing or leading to dysfunction in that organ system.
So maybe a important takeaway to that is, right there at the end, then when you hyperglycemic or swinging a lot, and your cortisol is rising, that's literally going to impact the use of T4 and converting to T3. And then that therefore, if you don't have a lot of T3, you don't have a lot of active form of it, and you actually can't use that thyroid hormone to actually use your metabolism, right? So then your metabolism is kind of stuck, which, think about how you feel with hyperglycemia. You feel sluggish, right? Lethargic. And you're like, man, I just feel achy. I don't want to move. Like, things slow down. Your digestion slows down. That happens for a variety of reasons of how, insulin, lack of insulin will change your gastric emptying time, which we've talked about. But man, if you don't have that thyroid hormone, that's going to slow your digestion down too, right?
Mm-hmm. Yep. And then from I guess a secondary or an indirect way as well, your sex hormones can impact your thyroid hormones, more specifically because of the binding globulins. So when your estrogen is high, then that's going to cause more of your thyroid hormone to be bound up, which then there's less of it to then get into the cell. So you may be producing enough, but it's not able to then get into the cell. So there's a lower free form of that thyroid hormone. And high estrogen depending on, so like in males, high estrogen is very common when you have lots of high blood sugar, because it leads into an increase in the aromatase enzyme when you have a lot of insulin resistance, especially in the fat cells, which then that aromatase enzyme converts testosterone into estrogen. And so with high estrogen, especially in males, you're going to have a lower amount of that free form of thyroid hormone to get in the cells. And then at the same time, testosterone, high testosterone, whether male and female, that will cause more thyroid hormone to be in the free form. So pushing it maybe a little bit too hard in your system as well. And then again, blood sugar can affect both of those sex hormones, both directly and kind of indirectly, and therefore then affecting the thyroid.
That was a couple mic drops for sure, and a couple steps maybe people weren't ready for once you start talking about testosterone and estrogen. So let me see if I have one of these correctly, right? So when your blood sugar is higher and cortisol is higher, that's going to then increase the aromatase enzyme. Is that what you said?
So more so with the aromatase enzyme, the more insulin resistance that you have, because the aromatase enzyme is more strongly concentrated in your fat cells. And so when you have a high insulin resistance in your fat cells, then there's an increase in activity from that aromatase enzyme, which then converts the testosterone into estrogen. And that's more specifically in males, versus in females, that aromatase enzyme more so converts estrogen into testosterone. So it kind of depends on the sex of the person.
So this is almost thinking about, without talking about how somebody got to a more of an insulin resistance model, without, however they got to metabolic syndrome. I mean, all these things play into one another and part of each other's feedback loops, right? But, let's just say you have some kind of insulin resistance and hyperglycemia, and that's playing it just for the sake of argument, just independently, you have insulin resistance. And then that then can impact how aromatase is produced within the adipocytes, and then therefore the conversion of testosterone to estrogen and vice versa, males versus females, and having effects on that way too.
Yep.
So I think that's important to note and circle back then on saying, when these things start to go haywire, it can be a big mess, right? Like, what do you look at first? And sometimes the thyroid gland can be the root of it all, or sometimes it can be related to other things. Let's say you have more of a blood sugar issue and the thyroid is just responding that way, and then and then your hormones it can go back and forth pretty fast. Yeah
I would say more, I find more often that the thyroid is being impacted by something else versus the thyroid being the primary problem.
Sure.
Even in autoimmune conditions, like yes, your thyroid is being impacted by that damage that the immune system's causing, but at the same time, the things that's causing the immune system to be going haywire are also some of the things that are going to be impacting that thyroid function. So inflammation, any sort of toxicity in the system, both of those things impact both of those systems, both the immune system and the thyroid. And I find if you work on those things, those foundational things, blood sugar regulation, eliminating toxins, those detoxification systems within the body, essential fatty acids, the thyroid will respond well. And obviously those systems that you're working on specifically, obviously will respond well, and everything starts to balance back out. Versus I don't do a whole lot of like, let's give a supplement for the thyroid specifically and seeing much change with everything else. I find a better change if I support those other systems. Not only do those systems get better, but then the thyroid also responds a lot better than too.
So what would be, in your mind, what would be a possible mechanism, clinically, of somehow somebody having more elevated TSH, more thyroid stimulation as a feedback loop, leading to blood sugar dysregulation. Because I think I was looking at a study that was done in UK around 2017, and they essentially said that after looking at like 72,000 people, if you had elevated TSH, you had a 50% increase in prediabetes. Interesting enough, when they followed up for that number, which was about 2 years later, they found it didn't increase the risk of type 2 diabetes, but pre-diabetes. So how would you think there would be a mechanism of TSH being elevated first and then the blood sugar regulation kind of falls afterwards, even that blood sugar is such a foundational thing?
Mm-hmm. Yeah, I think when looking at those studies, it's hard to really tell maybe what's coming first too. Like, yes, the TSH is high, but then what is the rest of that feedback loop looking like? Does that mean that there's no thyroid hormone being produced? Is there less of the T3? That's always the hard nuance thing. But let's just say that that is the case. I would think that that has a lot to do with overall metabolism in the body, specifically with the liver. So when I say metabolism, not necessarily just talking about energy burning, but then also like what those cells are doing, because that's essentially what that thyroid hormone is doing, is stimulating that cell to do its function, and giving it that energy that it needs. So when that cell doesn't produce the energy that it needs to produce the function that it's supposed to produce, there's a decrease in function. So the liver does a lot of different things, and we've talked about the liver a lot, but it does a lot in regards to blood sugar regulation. And so because you have the first thing that happens when you eat something and it comes into your system, your liver collects that sugar, and first it's going to try to collect all that sugar and put it into glycogen, store it away.
Mm-hmm.
If you still have sugar left over, then it's going to try and take the rest of that sugar and convert it into fat to then store it into your fat cells and protect your body from that way. And then at that point, it's kind of done all it can do. If it's still getting high or there's still sugar left over, well, now that sugar is going to be leaking into that bloodstream and starting to rise. So I would say, if anything, that's probably the biggest kind of mechanism that would make the most sense in regards to how thyroid function decreasing could impact then your blood sugar. I would just say it's never that simple in regards to the thyroid alone being the cause of the blood sugar regulation. I imagine like it's easy to look at those numbers and kind of think about that mechanism, but when you take an individual from that study, they're likely not eating super well. Their lifestyle is probably not super well, which is conducive to both of those things happening, whether that be decreasing in thyroid function and also having blood sugar regulation. So you wonder if it's more of a prelude to what's going to happen anyways.
Right.
Kind of like what we look at with the lipid numbers in regards to like, okay, the blood sugar numbers on the blood lab look fine. However, when we look at the lipids, the triglycerides are through the roof, and yet the cholesterol is fine. That's kind of a early indicator that the blood sugar is out of control.
Right.
And it's not necessarily that liver dysfunction is causing the blood sugar to go out of control. It's more so that blood sugar, it's trying to do everything it can to maintain that blood sugar.
So I think in that sense, that's actually why that study was found increased risk of prediabetes, but not diabetes, right? In that they was only looking at one factor. It was literally looking at, it wanted to know the risk of increase of TSH specifically and diabetes. Well, that's just one step along the path of, metabolic syndrome and this crazy metabolic storm that happens when you get out of control like that. And so, the pre-diabetes always comes before the diabetes, hence the name, right? Once you're creeping towards that pre-diabetic level, or just A1C is creeping up, more and more things are getting more haywire. And so if you're only looking at TSH, well, in that case, then you might not be looking at all the areas to actually look at somebody who's diabetic, based on
not
the
really getting
inclusion.
a full metabolic picture,
Right.
just those limited numbers there.
I mean, if you're just looking, if your inclusion criteria is just TSH, and then excluding people who are diabetic, like, and all these other things, we're excluding other factors, and you're just trying to see that relationship. It's maybe there is relationships only there because it's specifically, that's like one of the first steps down the, to get you there. But in reality, there's so many more things happening.
Yeah. And that's kind of the case all the time, is that there's so many systems trying to work together to try and get you functioning better. And so, sometimes there is like one system that really has a big breakdown that then causes the rest of the systems to go out of control. But oftentimes it's a combination of them.
Right. No, it's, you got to look at somebody at the whole picture. And I think that's why, functional medicine and this alternative approach really catches things that, why you feel like you have thyroid symptoms, but your thyroid levels are fine, right? Or being diabetic and not having any energy to do the things you want to do. It's because we're able to look at everything in that direction. So super, super important. I think, I was looking at, talking about metabolic syndrome. I was looking at another study not too long ago that was showing how hyperthyroidism and metabolic syndrome is possible. But in those people, they found an overall decrease, like it's still metabolic syndrome, but less BMI, waist circumference, triglycerides, in people that had hyperthyroidism and metabolic syndrome compared to metabolic syndrome and those who had hypothyroidism, or actually subclinical, so not actually diagnosable hypothyroidism, which actually I was surprised to see in a study, a recent study, people using the term subclinical, because being in this functional medicine world, we use subclinical all the time, and a lot of times our medical brothers and sisters on the other side of the hospital think we're crazy for talking about subclinical things, but here we are in a study in Frontier. But anyways, subclinical hypothyroidism and metabolic syndrome had an increase of BMI, waist circumference, and systolic blood pressure and triglycerides and such. And therefore, if you have metabolic syndrome, you pretty much have type 2 diabetes at the same time. So it's really interesting to see how things are changing when looking at the whole picture. Just even use that term subclinical, and really thinking about people individually.
Yeah. And that's really where we need to get to in just overall the health field, which we are. I feel like we're getting there. But to just take a general broad scope swipe at things, you don't gain much progress there, and you end up, I feel like, causing a lot of problems with individuals because you're just saying, okay, you fit into this picture, so we're going to do this. But you're also not looking at the full picture of that person,
right?
And understanding, like, all right, these other systems may need to be supported to then actually get you better.
So let's circle it back, right? So we comment on genetic increased risk of a type 1 diabetic and getting like autoimmune thyroiditis, which is pretty much, for the most part, Hashimoto's. It could be Graves' disease, but for the most part, that's what that term means. So what, why do you think there's a link on top of the existing genetic relation between Hashimoto's and type 1 diabetes? What's happening? How can a type 1 diabetic, like I was saying, take control of their immune system, so that way they try to prevent something like that from happening if they see signs like that?
Yeah, so it all comes down to all the different factors that impact the immune system, which there are a ton of them. So identifying all the different things that may be impacting you and your immune system. So anything that can stress that immune system out, So from a quick kind of overview, that's any toxicity, whether it's coming from the inside or outside, anything you're being exposed to, whether on your skin, in the air, the water you're drinking, all those different things, your immune system is going to react to if they're in there. Then obviously you have infections, both clinical and subclinical. So clinical obviously being like you're having outward symptoms like nose, throat, chest cold, stuff like that. But then subclinical are things like are things that you don't have necessarily severe acute symptoms, but it is causing inflammation in the body and therefore immune dysfunction. And then you also have food sensitivities. So foods that your immune system doesn't like and shouldn't be in your body, it starts reacting to those things. And so if you're continuously eating those things, you're continuously stimulating your immune system, and your immune system will then try to look for anything that looks for even remotely like those things. And sometimes that ends up being our own tissues. And that really starts to happen when you start having poor gut health, and specifically what we call leaky gut or intestinal permeability, meaning that there are things getting into your bloodstream through the gut that aren't supposed to be getting in. Typically, those are bigger proteins. So your digestive tract typically just absorbs amino acids, which are the building blocks for proteins. When you start having leaky gut, now you're getting actually full proteins or peptides into the bloodstream, and those shouldn't be there. The immune system's like, hey, you're not supposed to be here. So it starts attacking it, eating it up. And the more you're being exposed to those things, the more your immune system becomes on high alert. And then, it's a higher likelihood that one of those proteins looks enough like your tissues that your immune system tags it and say, hey, this isn't supposed to be here either. And it starts attacking it then. And so in regards to the genetic discussion, yes, genes play a role in how your body functions. But at the same time, genes can be turned on, turned off. And at the same time, even if you do have those genes and they even are maybe turned on, not giving it more fuel to the fire can oftentimes at least mitigate any damage and or dysfunction in there. Because there's people out there, many people out there that have thyroid antibodies and yet have no symptoms of low thyroid or high thyroid. And that has a lot to do with how their immune system is functioning. Yes, they're producing those antibodies, but their immune system is calmed down, it's balanced, and therefore isn't attacking those tissues.
So if there's already a potential increased risk, and let's say you've never tested your auto antibodies, right? It's probably still, because you have type 1 diabetes, or maybe you're listening to this and you don't have diabetes, but you have another autoimmune condition, right? Because the likelihood that if you have one, your immune system is already going to be ramped up. There could be steps that you could take to be more progressive and be more cautionary to preventing something like that, which is never a guarantee, but it's something that you can live your lifestyle to be the healthiest you can be, right? Mm-hmm. So if you were to live your life in a way that would already be working on gut health, that would be already limiting, type of chemicals and things on your skin, that would be working on, noticing, oh, that I kind of have a sniffle after I eat this, or, maybe I have some kind of food intolerance of some kind, trying to prevent all these assaults that end up being towards your immune system, through the pathway of your gut and through your skin and those types of things that already going to be ramped up because you have an autoimmune. So not even talking about your immune system and your autoimmune condition, but in the case of diabetes, we're way likely to be inflamed, right? Mm-hmm. Our inflammation level is probably always way higher than somebody else's, and it can get there like with an accidental slip up, and that's okay. Not to fear monger or anything like that, but just being having an autoimmune condition, your body's already going to be reacting differently. And so doing everything you can to kind of mitigate those things are super important.
Yep. Yeah. It's once you go down that pathway of autoimmunity, you get you don't get to cheat as much and get away with it. So
Yeah.
having those slip ups, whether you want to or not, or whether that's on purpose or not, or consciously or not, there's going to be consequences. So if
Right.
you're willing to live with those consequences, that's fine. Um, um, if not, that's what it's all about. You gotta weigh that balance and try to do the best you can. It's all about working on those foundational issues and those lifestyle changes, and being consistent with those. The more consistent you are with that, the better your health will be in each specific system in your body, which then
Right.
leads to better health overall in your body.
So, and because I haven't had a comment on, because I did not reflect on what you intellectually said about all the things that impact, maybe a link between type 1 diabetes and like something like Hashimoto's. Another thing to comment on is your sleep, right? I mean, your sleep will impact your immune system so much. And you actually, while you sleep, in your different REM cycles, you have your innate immunity ramps up and then it dies down, and then your adaptive immunity naturally ramps up as you get deeper in your sleep. And so getting that deep sleep is really important for going through these cycles of actually getting your immune system to calm down and repair itself and not be as reactive. But your body's going to just be working better as you're sleeping more, and your immune system won't be as reactive if you're getting the proper rest and recovery. Again, something that I didn't take as seriously. And I was working so long to try to work on my gut health personally and all these other things, and now I can be more flexible but still cautious in my lifestyle while I'm working on my sleep, while I'm working on these other things. And it's something that's easy to do. When you hear gut health, you might think prebiotic, probiotic, aloe vera, all supplements galore. But hell, I mean, sleep hygiene, you can start working on immediately right away. You don't need a dang supplement to start working on that, right?
Mm-hmm. Yep. And it's easy. You just lay down.
Well, hopefully it's that easy, right? Sometimes we gotta unwind some habits and some other things.
Yeah, because sleep hygiene is something I work on a lot with my patients in regards to, like, I ask them specifically, okay, how long are you sleeping every night? But then also, what's the quality of sleep? Are you waking up at all? Because you should be able to sleep pretty soundly throughout the whole night. If you're waking up at all, we need to figure out what we can do to help, mitigate that or eliminate that, whether it be, a lot of it has to do with your prep before going to sleep, and sometimes stress inducers throughout the day too, like whether it be something as activating the sympathetics like caffeine or something like that. But then at the same time, leading up to bed, if you're staring at your screen, like that blue light stimulating your nervous system like crazy.
Right.
How are you supposed to then calm your brain down enough to get into deep sleep? Yes, you may be able to fall asleep, but how good a quality is that sleep?
No, absolutely right on. And then not to go down too far in the sleep rabbit hole, we should probably tie it back to the thyroid, right? Uh, so I'm glad that we spent some time on that, because we could just start talking about sleep cycles and how blue light affects your nervous system. We can go into a little bit more detail about all those types of things, right? And stories and patient success and things like that. But kind of wrapping back up, I think just like anything, like you're doing towards your blood sugar and trying to understand what impacts it the most. Thinking about your thyroid should never be something that you're fearful of, but let's say you actually have signs that might be creeping in. Go back to the basics, and that's really what it boils down to, and how to live the healthiest life, and what you think is probably the healthiest life. That's what you should probably do, right? And you don't need to make it super complicated, but it easily does get complicated really fast. And that's the whole point of taking the individual on it and thinking about you individually compared to just a number. But it all starts with just deciding, hey, I got to do something different.
Yep. And really, like, thyroid and blood sugar, the things that are going to help the most with those two things are the same things. So diet, obviously diet is the biggest thing for blood sugar, but diet's also a huge thing for your thyroid. So cleaning that up, making sure your blood sugar stays consistent, is going to do wonders for your whole body, not just your blood sugar, not just your thyroid. but your whole body. So those foundational things, I think sometimes we get lost in the weeds looking for an herb or supplement or a pill that's going to make this huge change and difference. And yes, we can sometimes find those, but long-term change and sustained progress comes from those foundational lifestyle, diet, exercise, all those good things.
Wow. That should be the highlight of the episode. What you do towards your blood sugar is gonna, and then things improve that will improve your thyroid. Simple as that.
Yep.
Right on. You got anything else for the people back home and the people in the back, Dr. Grady?
I think they're probably tired of hearing me talk about it.
So let's see, what else did we do? We had burst beta cells. What's your blood sugar? And then didn't we have a third thing in season 1 that we didn't do that often?
Like, was it like what made you feel free, or a diabetic win?
Oh, diabetic win. Okay. You got one off the top of your head? Diabetic win recently?
No. I think.
All right. Well, you're just a diabetic loser then.
Yep.
And I'm going to take the cheap way out because you didn't think about it. My diabetic win is just these podcasts and sitting down, recording about these, talking about diabetes. That's always a fun thing. That's my diabetic win for the day. And hopefully for the people back home, you're getting your diabetic wins with your blood sugar and some lifestyle changes that you're doing yourself too. So with that, we'll catch you on the next episode of the Diabetes Podcast.
See you.
Thank you so much for listening to today's episode. If you found value in today's conversation, we would appreciate it if you gave a 5-star review. It really helps us branch out our community and get our message across to those who really need to hear it. If you want to interact with us on social media, you can follow us on the Diabetes Podcast on Facebook, Twitter, and Instagram. Or if you have any questions, comments, concerns, or moral outrages, you can email us at thediabetiespodcast@gmail.com. Thanks.